Before the show starts, again, just like to say a big thank you to the sponsors, Air Canada Cargo, ATC Aviation, Bombelli, Cool Dolly and Cool Storage Solution, Etihad Cargo, and Sarco Airport Equipment. Thank you all so much. Ladies and gentlemen, friends, colleagues and listeners, here we are again, another session of the Pharma Digital event, and I've got two ladies of logistics joining me today. It's a great pleasure to welcome Nina Heinz, who's the Global Head of Network and Quality Temperature Management Solutions with DHL Global Forwarding. So Nina, lovely to have you on board.
Thanks, Chris.
Really appreciate it. And Enrica Calonghi. I think I got it right, Enrica. It was a block in my mind there, knowing I had to do it. And Enrica is the Global Head Pharmaceutical Logistics with Air France, KLM and Martinair Cargo. So Enrica, lovely to have you on board.
Great to be here.
Thank you. Thank you. Now, ladies, what we'd like to do firstly, if you can just give us a little bit about what you do and how things have affected you over the last 6 to 8 months. So perhaps we start with you, Enrica.
Yeah. So, well, all good. The last 6 to 8 months have been quite intense. Specifically, well, we had to, as a group, as colleagues, we had to start working from home, and that's a big challenge that everybody is having, and connecting in a different way, in a different on different platforms, getting everybody on the same boat. And then for airlines, it has been a quite intense 6 months, 8 months, with a lot of aircraft parked. The situation has been quite tragic and intense. Our colleagues at Passage, of course, they have been very hit by the pandemic. Luckily, at Cargo, we have been able to do something different and recuperate some aircraft and let them fly as cargo only. So intense.
Yeah, it has indeed. But hopefully now with these magical Mondays that we're getting, things are going to start to improve. So Nina?
Yeah, I mean, it's been an interesting 6 to 8 months. So I've always worked from home, so that hasn't changed much for myself. But a lot of my colleagues now are also working from home as well. So it's been a real change. For us, of course, the most important is to care for our colleagues, for their safety and their security. So we've put together a COVID-19 task force, as I think many companies have as well, just to make sure that we also take care of our employees and, of course, of our customers. Which brings me to the next part, which is business. So it's been crazy busy these last few months. So I can't complain about not having enough work. From our perspective, it has definitely been very intense, working together with our customers, working together with our partners like Air France, KLM. So there have been long weeks, long days, and I think there's more to come. This is only the beginning.
Oh, yes, indeed. Yeah. Now, ladies, the expectation from everybody outside of our industry is now very, very high. And the press is full of news, full of experts, full of critics, full of people who know what they're talking about, many who don't know what they're talking about. But in general, the public now has got a huge interest in logistics and especially our side of aviation. Now, with that comes a lot of scrutiny and at some points, certain negativity. So collectively as a community, we have to make sure that we do everything as well as we possibly can and better than most people would assume. Now, how well prepared do you think the industry is at the moment now that the vaccines are coming around a lot faster than was anticipated? So Nina, do you want to jump in on that one?
I want to say that I think we are very well prepared because we have a very solid foundation. So speaking for ourselves, we have over 20 years of working in the life sciences sector, and vaccines are not new to us. So, I mean, we already manage a lot of vaccine shipments. We're certified in a lot of our locations around the world. We have trained staff that's CDP compliant and knows how to handle these shipments. So from that aspect, I think all of us have a good solid foundation are there to meet the challenge. However, where I think there's going to be a little bit more difficulty is capacity. And capacity from many different angles. We've got the capacity, of course, from an air freight perspective in terms of the actual aircraft moving. With the reduction of the number of passengers flying, obviously that doesn't give us the belly capacity anymore. So now we have to rely on other means. So at DGF, we've put into place now a schedule of over 40 flights per week, charter flights, so to make up for that lost passenger capacity. And then, of course, capacity also when it comes to storage. So temperature-controlled storage facilities around the world is also something that we really need to look into and make sure that we prepare for also all these temperature-controlled shipments that we're going to be handling.
Exactly, exactly. Now, Enrica, obviously from your side of the fence, okay, what's your impression? What's your opinion?
Well, are we ready? Yes, I think that we are doing everything that we can to be ready. Like Nina said, also at France KLM, we have a history of shipping vaccines. And a few months ago, we set up also another task force, not only related to COVID-19 and the safety and security measure, but also around the distribution of COVID-19. Getting ready internally, but also asking who else is around us to participate. So we have a collaborative setup with the airport of Schiphol and with the airport of Paris, so that we are trying also to get together ready. So it's not only the airline, but also it's the grounding agent, the tracking company, etc. So to make sure that it's not only looking at ourselves, but looking globally at the community. Good,
good, good. And I think this additional focus we've got, people don't realise, because they're hearing 8,000 full freighter loads and how much, how many go. It's not all going to come at once, because the associated logistics from freezer to arm, that also has got its challenges and its hurdles. So now that we've had Monday news about Pfizer and obviously the temperature sensitivity, then we got an improvement with Moderna. Now Oxford, we've got a different option again. So it seems to be that every Monday we're getting a better option. And collectively, all of these vaccines are now going to offer a very, very, very nice balanced approach to what can and can't be done, both in the shall we say the more obvious markets, and then in the third world countries and where people need to get an awful lot of support. So there's going to be a lot of learning in the first waves. And I think at the moment, we don't know what we don't know, because obviously the packaging, the volumes, everything else has yet to be decided. So I think everybody's aware of that. Now, once it comes, and both of you have said how well prepared the industry is with regards to handling of pharma, because of GDP and because of CEIV, the industry now is really, really, really well honed and well used to what's expected. Would you both just give a little elaboration on your understanding of GDP and CEIV and why it's so beneficial within the industry? So, Enrica?
Yeah, so for us, there is a fundamental difference between GDP and CEIV. For us, GDP is a wholesale certification. Being in an airline, we believe that CEIV is the certificate specifically for freight, because it takes the process that are related to indeed the air freight industry. So that's for me the major difference. We believe in this. We have been the first major airline to be certified, both in the hubs and in the process. We have been recertified, so we had reassured and reaffirmed the focus that we have on this and on the continuous improvement.
Okay, very, very good. And Nina?
Yeah, it's very similar. So I wouldn't say one is better than the other. I think they're complementary.
Yeah.
So we have facilities where we provide long-term storage, and hence we have licenses offered by the Ministry of Health. So this is the wholesaler distribution authorization that Enrica referred to as well, which allows us, of course, to do many other activities. But then we also have over 30 sites now in the world where we have CIV Pharma certification. So we're definitely playing both angles, if you will. It's important for us to be CIV Pharma certified, I think, because the CIV Pharma aspect brings in, it's air freight, if you will. It's GDP translated into air freight. So you're talking about having things like the checklist, you have the labels. It's very concrete and more operational. And it also helps us to speak the same language with our partners. So that when I'm speaking to Enrica, for example, at Air France KLM, and I can say certain things and we're speaking the same words. So we both know what our GDP requirements are, how that's adapted to air freight. And so that also allows for a stronger partnership in evaluation. So I think there's a lot of benefits to this. And I think the program is also getting increasingly recognized, recognized also by the customers. So we're also seeing a lot of customers coming to us and saying, okay, you know, a business is up for bid. Are you CIV Pharma certified? So that recognition, of course, and the endorsement that we're getting from the customers is also going to be very important for all of us.
Yeah. Now the pharma community is relatively small, and it's well in touch with each other, and it's quite demanding. So from an upstream demand that comes to you, Nina, when you're then looking at your partners and capability and partners, and you're doing your selection criteria, what levels of validation and verification do you have to go through so that you're then confident with your choice of carrier?
So what we do is we have a global approved carrier program. And so the first step is that we actually conduct a joint audit. So the audit means that we would then, in these times now remotely, but ideally on site, come to the hub of that particular airline partner and do an audit looking at their GDP capabilities, their compliance, looking at their trained staff, looking at their cool rooms, their procedures, everything that's in place. And based on that, we issue an audit report and we work out closing that out. We also sign a joint life sciences quality agreement that we also have in place. And we even have a monthly scorecard where we actually monitor the performance of our partners on a monthly basis. So it's a very open exchange of communication and collaboration. We even have a DHL Care Award that we have on an annual basis where we even recognize those partners that we feel that for life sciences particular have really shown excellence in how they've achieved all the services they provide. So it is very much a partnership approach that we take.
That's brilliant. And with that in mind, some of the things that you look for in carriers is the way they openly agree and support their own self-assessments, their own internal audits, their own training program as well. So it's like-minded parties all the way along the process, yeah?
Yeah, absolutely. It's the like-minded parties, and it's also always that concept of continuously improving and also innovating. So we even factor in the innovation aspect when we do the Care Award because we find it so important. So it's partners that are also looking together with us to drive some of those improvements that we need to continuously make, to take on some of those challenges and to open new doors and try new things and be open for that collaboration.
Okay, very good. And
if I may, Chris, to add on that, collaborations and innovation is also transparency and it's also sharing the information. So
yes, indeed,
it's good to have now to invest in the tools and in the means to be able to transmit the information at every level of the pharma shipment to our partners like DHL.
Yeah, and don't you think the one good thing that's come out of this pandemic is that people are starting to be people and they're being a lot more confident, and you use the word care, Nina, and also Enrica, and that they are actually caring now. So it's in a way nature has sort of given a little bit of an elbow in the ribs and said, look, you know, you need to sort yourselves out a little bit and all get together. So from that perspective, it's not a bad thing.
And air cargo has never been so much in the media and in the press, right? So everyone's talking about transportation, sharing little articles and videos about how important air cargo now is. So it's nice to see that.
Yeah. And please God, touch wood, when things start to turn, there'll be an awful lot more people now looking at it as a chosen career. And everybody used to say it wasn't sexy and it wasn't in vogue and nobody understood it. There's going to be a lot of demand, I think, for people coming into the industry in the future, which will be a great thing.
Great.
Now, taking that pendulum on, Enrica, and as you pass it downstream, you also do your own selection process with tenders, etc., on the GHAs.
Yeah. And we do have a program for that. It's also part of the CAV program to really have not only the selection but also the check that they are the continuous check that they are working and doing according to the guidelines and the standards that we set.
Yeah, and so for anybody listening, you know, even within the industry, but especially from without the industry or stakeholders, our sector is so regulated, so focused on safety and security. It's an excellent industry, and because of that, we're in great condition to take on the challenge now of the distribution of the vaccines. So that's one thing people shouldn't be too concerned with. However, the media and the press already, they're going to start making visits. They're going to start doing their spot checks. They're going to start wanting to speak to people about what are the downsides, the challenges, because unfortunately it's challenging or negative news that sells rather than positivity. And we've all got to be very careful because the first spoilage or the first problem is going to get such enormous media coverage.
No, absolutely. Fully agree with you. And I think Enrica mentioned, of course, also the role of the ground handlers and the airport, and it's extremely important. And I think it's very challenging because we need to be very open in our communication, in the sense of the ground handlers, the airlines, the airports are all coming to us saying, what do we need to do? Yep. Where do we need to invest? Do we need to invest in -70? Do we need to invest in 2 to 8? Do we need to buy dry ice, production facilities? What do we need to invest in? And I think part of the challenge right now is that there is still so much uncertainty.
Yep.
Every Monday we get a news flash, which is great, but I would love to get all that news together, packaged up, all in a bundle, and saying this is what we need. But I think at these times of days we need to be flexible, because not only is the information trickling in a little by little, but different customers have different requirements. So I don't think there's one size fits all. We've seen it with Pfizer and BioNTech, which has more the -70 range.
Yeah.
If you look at the announcement today about AstraZeneca, that's a 2 to 8 shipment, right? So it really will depend on what type of vaccine we're looking at, what those temperature requirements are, and even further down the line, what kind of distribution model they select. So I think right now being flexible and agile is going to be really crucial.
Yeah, no, definitely.
And there are some possibilities. I mean, the climate room and the cool room that Air France KLM Cargo has built recently have this flexible switch to be able to switch from one temperature to another in case of need. So the flexibility indeed is very important. Being attentive and sharing the information is also very important, because we are not in this alone. There are so many parties in air freight that everybody needs to be up to speed with the requirements.
Yeah, no, 100%, 100%. Now, one thing that this pandemic has taught businesses is about continuity and sustainability and being aware of risk and mitigation. So with the fact that we don't know what we don't know yet, a general practice is to keep aware and mitigate against all potential risks. So you're all continually doing risk assessments and risk reviews, correct?
Yes, absolutely. That's part of what we do. I mean, right now we're looking at mapping our facilities. Yep. So it's a global exercise, working together with our colleagues to make sure that we have a clear insight and overview of what we have in terms of facilities, doing a gap analysis, and then trying as best as we can, of course, to estimate where we think there will be a need. But we already have a few facilities. Just I think it was a few days ago we made the announcement, and my colleague in San Juan is that we're expanding our DGF San Juan facility as well. So a facility that we're going to be expanding when it comes to 2 to 8 facilities, but also when it comes to the deep frozen, the -30 range, and also the ability to handle active containers. So we're already starting to make some of those investments where we foresee the need for greater temperature controlled storage facilities, and working with our customers as best possible to set that up.
Brilliant, brilliant. Now another issue, and obviously Enrica, from the carrier perspective, and like a lot of the places that I've been based in or worked in, especially in the Middle East, the heats and the extreme temperature changes, as soon as that cargo door opens, the way the temperature goes up within minutes is incredible. So from the aircraft all the way through to the vehicles, etc., that's security of temperature monitoring and tracking is so important. So now the advancements in technology and trackers and telematics, etc., that's really, really crucial as well, isn't it? For to boost confidence, so that there's no like ramp ramp spoilage.
Yes, and there are also some technique to prevent heat during, or to prevent exposure during the transportation. Yeah. Some airports do have, and customers can choose to make use of that. What is important for me, I repeat, is the transparency, making sure that our customers know that if not, this is the maximum time in which the pharmaceutical and potentially the vaccine is exposed to room temperature.
Yeah, no, definitely. And you're all, well, both of you keep saying about the transparency and the collaboration, etc. When you look at another term that everybody is using now, task force. You've got government task forces, you've got regulatory body task forces, carrier task forces, airports, GHAs, integrators, charters, brokers, LCCs, private aviation, FBOs, you've got last mile providers, you've got temporary or second line facilities, you've got so many task forces. I think people from outside will be wondering how on earth do they all get, communicated and coordinated. So just my personal opinion, I think the airports now need to take a very, very central role for their own ecosystems, wherever they are, to make sure that anybody representing that particular airport with regards to pharma, vaccines especially, is all part of that overall task force.
I totally agree with you. I cannot agree more with you, because I think that if everybody is only looking at their own little task force, we are not getting anywhere. Only with the bigger task force, and I have the example of the one in Schiphol we built together with Schiphol Airport. We're really concretely working on some topic, and it involves all the actors around the airport. That's perfect.
Yeah, and Nina.
Yeah, I mean, from our end, you mentioned the airports, and so we're actually a member of a group called Pharma.iro, and they just launched an initiative together with TIACA in August called the Sunrays Initiative. It's a project focusing on COVID-19. And some of you may have also filled out the survey, but there was a survey that was sent out to really try to understand where people see the challenges. And one of the challenges is that the airports and ground handlers actually felt less prepared at the moment for the COVID-19 vaccine, because I think, as Enrica mentioned, part of it is this lack of information and lack of transparency, but all the while, a lot of the burden of responsibility is resting on their shoulders. So those companies that are already engaged with the manufacturers, I think, are feeling a little bit more prepared because they're closer to the source of the information. But down the supply chain, I think, airports, for example, are really struggling. At the same time, I do feel that the willingness is there. So they're willing to take on the challenge and to open the floor for discussion, to really understand where such investments need to be made. And I think one thing we can't forget is, of course, also the governments. So governments will increasingly play a role, and we've seen this in the first cases where we've supported the distribution of the vaccine. The government role is going to continue to be very, very important.
Yeah, 100%. And I'm sure, for lots of, well, if you take Europe or some of the larger domestic markets, a lot of the initial distribution will be by truck. So it'll be by road or by train. So there'll be a different section. But I think when it comes down to aviation now and the distribution to some very far and remote areas, so that everybody gets their fair share, and like the saying is, we're all safe when we're all safe. So I think that's where the technical expertise is going to come to its fore, and it's going to be so valuable. Now, something I'd like to ask you both. Okay, now with COVID and with this unique experience that the whole world has gone through together, so many people have been displaced through no fault of their own. Practical sizing in airlines, people have been made redundant, they've lost their jobs. The anxiety and the stresses are there. So when it comes to SMS and human factors, and now there's got to be so much more understanding and appreciation of why things are being done to maintain the the security of the vaccines, etc., as they go through. Are you guys doing anything differently with your people? Are you given a different approach to like why leadership is so important, and from an employee's perspective, why they should be supportive of leadership, because decisions still have to be made. Some people will be working from home. Some people are on the front line, so they're still risking themselves. It's a totally different dynamic now. So it's almost like a new generation of leadership that's necessary, focusing on the reasons why. Because in the past, it was more, this is what you've got to do. This is where you have to do it. This is how you do it. But now it needs to be, this is why you do it. So everybody understands. And then that word care can come back into everybody's, everybody's way of life.
Yeah, no, absolutely, Chris. I totally agree. I think just to give you a few examples, we have our regional CEO, and on a weekly basis, he shares a success story. And a success story to motivate people, to make people proud, to make people realize that every day that they work in the warehouse, or that they're working from home, managing their kids at the same time, that there is a reason for why we're doing this, and that there are concrete success stories behind this. Putting faces as well. So we're trying more and more now, just like we're doing here, to do more of the visual conference, not just hear voices, but to actually be able to see people.
Yep.
And then at least in some parts of the world now, we're coming to the holiday season, which is also an important time. It's Thanksgiving in the US next week, and we have the Christmas season coming up as well. So that also for us, we've taken the initiative, just to give you an example, of we're creating a company cookbook. So everybody is going to be able to provide their own recipes with a little picture. So my picture is of my kids making chocolate chip cookies, and sharing those recipes and bringing in some of the human factor of caring for each other and knowing that we're all there together.
Yeah, no, so important. And Enrica, you agree with that?
Yeah, absolutely. And it's fun how things are evolving in a different way, and how much business we do now on WhatsApp, and how we can create also the group of WhatsApp of our pharma colleagues, and we motivate each other. And now it's different, but I'm not saying that is less important or less motivating.
Yeah. No,
but I still miss the travel. So it doesn't replace, seeing people. So, and I'm not saying this just to boost the travel industry, but I really do miss also seeing people face to face. So hopefully we will be able to set that up again soon.
Yeah, I think there's a nice balance now, because people were always skeptical of people working from home and remote. And I think now they can see a huge value of it, and the balance of life as well. And it shows that productivity can actually be enhanced, which is a good thing. But I do feel that as soon as the opportunity gets out there, once the vaccines start to kick in, people are going to want to see people again face to face.
Yeah, I agree. It's when you work with people, it's easier, because you already have that trust and you have that relationship. Yeah. But I think it's especially hard when you've never seen someone before. So meeting people and making that contact, you definitely need to see people in person.
Yeah, 100%. Yeah. And
from an airline perspective, I really hope so.
Oh yeah, no, really. Yeah, no, we need to get people back on the planes, which are actually one of the safest places you can be. Now, Enrica, people are, and someone as old as me, I'm still frustrated with the fact that there's so much documentation and we haven't been able to address that. And now, from a hygienic perspective, that should be the stimulus to actually get rid of it and start to be, more digital. But also digitization and automation and people's way of thinking. It would appear that 2020 has been an incredible year, and it's almost a decade's worth of push and drive has managed to be, successful, rather than the old days of, all that legacy waste and admin and bureaucracy and just in case, and why change. So I think that's going to be a good thing for the future as well.
I hope so. I really hope so. I mean, we have been in the digital area at Air France KLM Cargo, and trying to convince our customers to go digital in all aspects of the job. Also, having the quotation, making the booking. Instead of calling, making it online, so that our team is working on something that is also more stimulating for them. And indeed, it will be e-documents we are getting there. I think that we are getting there. I think we started something like, Nina, 5 years ago to really make this slow change. And I really hope that this moment is a moment to say, okay, full swing on paperless.
Yeah, touch wood, touch wood. Now, looking at the way things have developed, and obviously the outsiders look at cargo, especially, whether it be airports now and the way they consider cargo, whether it be airlines, whether it be all manner of businesses, cargo now is really getting some respect that it probably never ever thought it could do. Now, pharma within cargo has always had that sort of exclusivity, but it also needed to be pushed and respected as well because of its difference and its importance. Now, with this particular issue, do you think there's going to be almost like a layered approach, because there's going to be like fast track pharma lanes, fast track pharma products, fast track, should we say, levels of service, and it's going to make service levels become more important as well as we move forward?
I think from my perspective, I mean, we've already been managing vaccine shipments, and there's a lot of important life-saving shipments out there. It's not just COVID. So, if you have a patient that's waiting for their insulin, or another person who is waiting for their blood plasma or whatever cancer treatment. So there's a lot of pharmaceutical shipments that are already out there that we are moving today. And I think the challenge that we have with the COVID vaccine is that we continuously need to move those other life-saving products as well. So it's very challenging to now all of a sudden say, well, COVID is the most important because of all, the government attention, the media attention, and of course the human factor, which I fully agree with. We're all waiting for the vaccine. But in the meantime, we still need to manage that constant supply of other life-saving products and other important shipments as well.
Yeah. No,
we don't want to add complexity. We don't want to add complexity to the supply chain. I think we are already in a very complex environment. So I think it's a matter of just expanding that capacity.
Yeah. No, I see your point there, Nina. What I was mainly talking about is there's so many people within our respective organizations who, if they're specialists, they know all about it, but the rest don't know too much about it. Whereas now everybody is taking an interest in it. And I think even when you see, all of us, okay, so when we were traveling, if you're on the bus transiting from the stand to the terminal, if you're in the business, you look at what's going on. And sometimes you see certain practices and you think, maybe that could be improved. Maybe that's not as best as it could be. But I think now people are starting to accept and associate the right way because they're starting to understand why, and it's the same thing with dangerous goods, lithium batteries. There's so much understanding now, whereas people almost, it wasn't their specialization, so they took it for granted. That's what I'm
That's true. I think we're seeing it also with dry ice. So dry ice is now the hot topic. All right. So we're in the midst right now of implementing a dry ice training refresher for all of our colleagues, because in the past, dry ice, well, either you're an IATA DGR expert and you know how to handle dry ice, or you're not. But now actually we need to make sure that everybody is aware of the health and safety requirements, but also the correct proper handling mechanisms for handling these dry ice shipments. With all these ultra frozen, COVID vaccines that we may be coming up, there's going to be a lot more involvement of everybody in handling dry ice. So that's typically something now where the awareness is raised because of this topic, which in the past was just certain specialists, but now everybody needs to be aware of it.
Exactly.
And maybe, Chris, if I may, maybe with the vaccines, we will be implementing something new that maybe can be used also for other type of pharmaceuticals and life-saving, insulin, etc. So I think it's a win-win at the end of the day.
Yeah, 100%. And like you're saying about there with the dry ice, lots of people don't realise what an oxygen suffocator it is, and and how you got to be so careful with your hands and the way it's handled and all manner of issues. So there's a lot of expertise that's required. And again, thankfully, this particular focus now is showing how professional our industry is.
I agree. And I think to go back to the dry ice topic, I think it's also an area that we've realized now that there is real need for collaboration. So unfortunately, the way that we're set up now is that, yes, there are certain dry ice level restrictions per aircraft type. Now, ideally, we would be able to obviously see that we could work with the aviation authorities to increase those amounts.
Yep.
But ideally, those amounts would also be the same for every airline. So now every airline's doing their own thing. And in the past, that's that's worked quite well. But now, just because of this tremendous, huge volumes of these shipments moving, it would be so much easier if we could have a standard approach that all airlines would slightly increase their amounts to be able to handle these huge volumes, but then to have some sort of standardization across the industry, which would facilitate everything for everybody.
100%, 100%. Now, if I was to ask both of you, if you had a magic wand or you had a wish list, okay, what would you wave the wand at or wish could actually be available across the board to make everything more consistent, collaborative and transparent? Or what would you like to see being supported from outside to make what we're having to address a lot more effective and easier?
Well, if I go back to where we were, the lack of information was something that was a real struggle at the beginning. We were working on, I think, 6 or 7 scenarios because we did not know exactly what to expect. If I would go back, the information on hand a little bit earlier would have helped in zooming into certain topics rather than many, so that we could have worked on what exactly is needed. Then I think that's the collaboration that we were mentioning before. That for me is very important.
Yeah.
And Nina just mentioned if all airlines would go with one file and apply for increase of dry ice limits on our aircraft. But we are not there yet. So everybody is doing their own things. I mean, there are some initiatives here and there. IATA is also, I don't know if you saw, because they published, I think,
the guidelines.
Guidelines. More collaboration is always that would be my magic wand.
Indeed. And Nina?
I think my magic wand is still going to be quite realistic. So I'm not a big fan of magic. I'm very pragmatic. So for me, I would just wish that everybody could be flexible and agile. Yeah. So I read an interesting article where they were talking about how in the times we used to talk about just in time, and now it's just in case. Right. Yeah. So it's that flexibility. We will have different types of vaccines from different manufacturers to different parts of the world. We're going to have to be able to adapt very quickly, be very agile. So that's going to require collaboration and communication, things that we've already talked about. But I think if we have that willingness of the industry to say, let's be flexible, let's be agile, and let's try to adapt as the information comes along, as the vaccine is ready, that'll be important. And also just to think about, it's not just the vaccine, it's the test kits, it's the syringe. It's the the manufacturing machines that we will need. We're still sending out a lot of PPEs as well. It's treatments, hopefully, that we'll also be sending in the future. So they're all of these shipments together. It's not just the vaccine. It's the bigger picture that we need to keep in mind, because that's the only way that we're going to win this pandemic.
Exactly, and what it does to the general cargo and the urgent products that have to keep rolling and rolling until the passengers get the confidence to come back and start flying again.
Yep, absolutely.
Yeah, it's a complete package. But I do think genuinely people are being less demanding for everybody to say they know what's happening immediately, because it's such a dynamic and it's changing. And like I say, every Monday is a clear example. It's been Monday to Monday to Monday. It's been fantastic. And the more people learn, the quicker we'll do things. And it's also that level of patience, and I think more positivity will make things so much better.
It's a level of trust as well. So it's trusting each other, so that when we do get that information, we will share that information. We're not hiding anything, and if we can, we will. So all that collaboration is based on trust and good relationships.
Yeah, 100%. Now, ladies of logistics and such a positive group, listen, we're coming to the end of the podcast. I'd just like to say thank you so much for sharing your ideas, your thoughts, but more importantly, the consistency in what your thoughts are and what you think should and shouldn't happen. And with professionals like yourselves, I think everybody should have every confidence in how well things are going to go as soon as we know the detail. So thank you so much. Really appreciate it. And I look forward to seeing you at a conference somewhere, sometime in the future.
Thank you, Chris. Thanks, Enrica.
Thank you.
Thank you very much.